Assalamu alaikum. I'm Dr. Muhammad Jalal Mohiuddin, working as a consultant for Orthopedics Western Hospital, Lakdikapur. Today I have very informative and important lecture, which is related to a common problem in the modern era, that is vitamin D deficiencies, and lot of doubts and queries of the patients and the clinicians who are taking care of or who are dealing with vitamin D deficiency. Why I am focusing on this topic today is frequently I get the patients with vitamin D deficiency, and most of the time, physicians are either prescribing very high dose of vitamin D, which may be toxic to the patient, or sometimes the vitamin D doses are so some minimal or so less that it is not an effective treatment. Uh, how to deal with the patient who are having vitamin D deficiency adequately? What is the vitamin D requirement depending on the age and the status of the patient, and how it need to be administered? All these queries I'm going to clarify in this lecture. So before going to the proper vitamin D related problem or vitamin D supplementation, I just want to recall the biochemistry in a very simple and easy way. A few things about vitamin D is vitamin D is a fat soluble vitamin, and it influences intestine. So it is responsible for absorption of the calcium, absorption of the magnesium and phosphate. So the balance between the calcium, magnesium, calcium and phosphate, magnesium, phosphate and calcium. All this is taken care by vitamin D. So we have many forms of vitamin D, but human beings we have commonly find have two forms, which is called as vitamin D3 and other is called as vitamin D2. Vitamin D3 otherwise called as cholecalciferol, vitamin D3 otherwise called as ergocalciferol. So vitamin D3 is the most common one, which is found of animal origin. So it is either synthesized in the body of the human beings, or if we are getting in the our food, animal related food. Whereas vitamin D2 is synthesis in the fungi, mushroom, and plants. So it is non-animal source. Animal source, vitamin D3, cholecalciferol, vitamin D2, ergocalciferol is fungi, mushroom, and plants. So how it is getting converted in the body? So as I told that this is vitamin D3 and this is vitamin D2. So what happens is there is 7-dehydroxy cholesterol present in the body. On exposure to UV radiation, it is getting converted into cholecalciferol, otherwise called as vitamin D3. This is in the liver getting converted to cholecalcidiol. And in the kidney, it is finally getting converted into cholecalcitriol. The same way the food directly we are having ergocalciferol, vitamin D2, which is in the liver getting converted into ergocalcidiol, which is finally getting converted into ergocalcitriol. This is the active form of the vitamin D which act on the receptors. So this is how I just want to make it in the pictorial form. Here, if you see, this is the skin where we have dihydro cholesterol, which is getting converted to cholecalciferol in the skin by UV radiation. And when it enters into the liver, so we have the source is from our body, that is from the skin, we are getting vitamin D3. Otherwise, with the food items like plant and non-animals, we get vitamin D2, or in animal sources, we'll get vitamin D3, cholecalciferol. This in the liver, it is getting converted into 25 dihydroxy vitamin D3. So it is called as calcidiol. This calcidiol, when it enters into the kidneys, it gets hydroxylated 125. So finally, we get 125 dihydroxy vitamin D3, which is otherwise called as calcitriol. So calcitriol, which is active form, it acts on the receptors. So when in the blood we are doing vitamin D test, so we are estimating the level of calcidiol, not the calcitriol. This is not estimated, we are estimating this one. Okay, this point is very important. So then this is last slide about the vitamin D. So as I told, vitamin D, either it may be cholecalciferol or algocalciferol, the half-life is 2 months. When it get hydroxylated, that is calcidiol, it forms, the half-life is only 15 days. As I told you before, this is what we test in the serum to estimate the level of the vitamin D. The last thing, which is the active form, is calcitriol, which lasts only up to 4 hours. So it has very short half-life. So what is the role of vitamin D? Vitamin D is responsible for bone health, which everybody knows because it affects over the calcium and phosphate balance. It helps in maintaining immunity. So this effect of the vitamin D was used when patient had corona infection. So we have given lot of vitamin D supplementation in patients who are having corona infection. It helps in maintaining the strength of the muscles. It is responsible for maintaining mental health. It has anti-tumor and antioxidant activity. It is also having anti-inflammatory and anti-fibrotic activities. There is a correlation of psychiatric illness if patient have vitamin D deficiency, attention deficit hyperactive disorder, and lastly cardiovascular system also. There is high risk of patient developing cardiovascular insult if there is a vitamin D deficiency. With this background, we'll have few queries. These are the queries which commonly comes in the mind of the clinician when they come across the patient who is having vitamin D deficiency. How much is the daily requirement? What is the natural source of vitamin D? What happens in vitamin D deficiency? Who is at high risk of developing vitamin D deficiency? And how to supplement vitamin D if patient is found to have vitamin D deficiency? And how to supplement vitamin D specifically in pregnancy? And is there any rule of having maintenance or blanking treatment in family and high risk group? So we'll answer all these queries one by one in the coming slides. So how much is the daily requirement of vitamin D? So daily requirement of vitamin D depending on the age of the patient. If patient is from the birth to 12 months of age, the requirement is 400 international unit. Up 1 to 18 years, it is 600. Again, 18 to 70 years, it is same as 600. But when patient becomes old, more than 70 years, the requirement slowly increases, a little increases to 800. So 400, maximum of 800. And what is the values of vitamin D in the blood? So as I told, it is calcidiol, which is we are measuring in this one. So if it is less than 20 nanogram, it is deficiency. 21 to 29, it is insufficiency. More than 30 is what we required, but when it crosses 150, it is considered as a toxic level. So this is requirement in a normal population. In pregnant population, we need, if patient 400 international unit extra in addition to what they need daily. So here 600, this is 600 plus we are adding 400. So total the normal female, she required 1000 international unit. But if patient is having belongs to high risk group to develop vitamin D, so they need 1000 international unit extra. So total requirement is 1600. So normal pregnancy 1000 unit. If it is at high risk, then they need 1600 international unit. This is the requirement of the vitamin D. What is the natural source of vitamin D? So natural source of the vitamin D is basically sunlight exposure than the UV rays present in the sunlight. So ideal time is between 10 a.m. to 3 p.m., not the early morning or at the time of sunset. It is in the afternoon or just before noon. Then if 30 minutes of exposure is there in the involving face, upper and the lower lip, they can generate 50,000 unit of vitamin D. That is in fair skin population, not in the dark skin. Then if you somebody is applying sunscreen with protecting factor of 8 or more, then there is, it blocks the UV rays penetration and there is no production of vitamin D. So sunscreens also decreases the vitamin D production. And the lastly, glass windows. So many people, they have for this in the mind that they are exposed to the sunlight, but they throw the glass windows. So if the sunlight is coming to touching your body, penetrating through the glass windows, then it is poor, there is no UV radiation in it. So it won't be able to synthesis vitamin D in your skin. So coming to the food sources, only the food sources is cod liver oil. So we have in the 1 tablespoon of cod liver oil, which is not commonly used in Indian scenario, is 1300 international units. Whereas when you compare milk, egg, and other things, they are very less in vitamin D. So they are poor sources of vitamin D. Only the good source of vitamin D is cod liver oil or mushrooms, which we use very less frequently, and salmon fish and all. So fruit and cereals almost have no vitamin D. So either you need to get vitamin D from sunlight, or you need to get vitamin D from cod liver oil or some fish related things. So that is the natural about the natural source of vitamin D. So what happens in vitamin D deficiency? In neonates, patient may develop hypocalcemic seizures. In the toddlers, they develop rickets. In adults, they have osteomalacia and stress fracture. In the older age group, they have osteoporosis in addition to the other factors, and they also may have stress fractures. Whereas in pregnancy, if there is vitamin D deficiency, they are a high risk of developing preeclampsia, landed up in low LSCS. There is chances of impaired glucose tolerance, low birth weight, hypocalcemia, and poor skeletal formation in the fetus. So, who is at risk of developing vitamin D deficiency? The people who are staying indoor. Now it is even in the schools also there is no sunlight exposure, so they are at high risk. Then offices also all AC under the AC, so these all are poor source of high risk of developing vitamin D deficiency. Dark skin population, obese people, and the patient who are on steroid, patient who are on statins, and patient who has history of gastric sleeve surgeries are at risk of developing vitamin D deficiency. So, people who are at high risk of developing vitamin D deficiency, they need almost double the daily requirement. If the daily requirement is 600 unit, they need 1200 unit for the maintenance. Then the important questions come here. How to supplement vitamin D? So if the patient, it is depending on the group. If patient is less than 1 month, 1 month to 12 months, up to 18 years, more than 18 years. So we can either give in the daily form, weekly form, or a stress therapy or bolus therapy. So if it is less than baby is less than 1 month who has vitamin D deficiency, you can either give 1,000 unit per day till 12 weeks or 8,000 unit per week. So if it baby is up to 12 months, then 5,000 unit per day or 30,000 unit per week for 10 weeks, 10 to 12 weeks. Like if it is 18 years, 5,000 unit per day or 50,000 unit if you are giving weekly. The same way for the adult couple. But if you are doing, there is no role of cross therapy in the neonates, and if you are giving up to 12 months, 3 lakhs unit, 1 to 18 years, 3 to 6 lakhs unit, single dose, single dose. So I found many people, they are giving multiple injection, 2 to 3 injection in the very short span, that is weekly or alternate day. That will increase the chances of patient developing toxicity. Then after that, you need to maintain. So maintenance is in the up to 12 months, 400 international unit to 1,000. Whereas up to 18 years, 600, more than 18 years, there is little higher requirement for the maintenance. Then if patient is obese, the requirement is high. So you need to give 6,000 to 10,000 unit if you are giving weekly, daily. Otherwise, you can give stress therapy and the maintenance dose is very high. So here one point is very important is either you can give daily regimen, weekly regimen, stress followed by maintenance. So preferably up to 12 months giving IM injection is difficult, better to give weekly regimen. And if here the people are coming, then we can give the stress therapy here. But after giving the therapy, they are at high risk, so we need to give the supplementation or maintenance vitamin D. Then how to supplement vitamin D in the patient pregnant population? So if there is no vitamin D deficiency, it's just a female with pregnancy, you need to give 400 unit more in addition to the daily requirement. So 1,000 unit per day is okay. If patient is having high risk of vitamin D deficiency, like obese patient, dark skin, poor exposure to the sunlight, or patient who is having history of gastric sleeve surgery, 600 units is the daily requirement of the female, and you need to add 1,000 unit per day. So daily requirement is 1,600 international unit. But the patient, if having the vitamin D deficiency with low vitamin D level, then you need to give 3,000 unit per day. for 10 weeks. And it should be followed by 1000 to 1600 units daily. So acceptable supplementation in pregnancy is 4000 unit per day. We should not give more than 4000 unit in one day in the pregnancy. I find some gynecologists giving injection 6 lakhs unit to the pregnancy pregnant hypovitamin D patients. So it's completely unacceptable because it has some teratogenic effect and can land up in subvalvular aortic stenosis in the fetus. So the main thing here we need to know is supplementation of vitamin D need to be like physiological, like every body need daily 1000 unit or 600 units. So administration also should resemble daily low doses rather than you are giving monthly or weekly doses. It stand good for even normal population, not only for pregnancy, for normal population. Then is there any role of maintenance or blanket treatment in high risk group? Yes, it is. Because for normal individual, the daily requirement is only 400. For high risk, it is 1000 international units. So better we give this supplementation because to the siblings, mother and grandfather, because their food habits and the environmental habits will be same. The exposure to the sunlight, the type of clothing they do, or type of sunlight exposure, and the food they use itself. So better to give the blanket treatment to the patient who is having vitamin D deficiency. So this is a last slide here. So if what is vitamin D? So it include like cholecalciferol, calcidiol, calcitriol. So here comes your kidney. Here comes your liver. Here is the skin. So if there is poor sunlight exposure, then all three will be less. If there is a poor sunlight exposure, we have low calciferol, low calcidiol, low calcitriol. If patient is having same poor supplementation or poor nutrition, they'll have all the three deficient. So that is low level of all three types of vitamin D or three subtypes of vitamin D. If patient is presenting you with liver failure, then he may have normal cholecalciferol because this all will is above the liver. So, but calcitriol or calcidiol will be low. But if patient is having kidney failure or patient is having involvement of the kidney affecting the vitamin D metabolism, they'll have normal calcidiol and they'll have normal cholecalciferol. So blood may show normal vitamin D levels, but the deficiency will be the rickets will be the presentation. Why it is presenting? Because calcitriol is deficient. So here we need to supplement calcitriol because we can't give calcidiol or cholecalciferol because there is a blockage of conversion. So if patient who is having renal rickets, always we need to give calcitriol. Then the last thing is few patients, which is very less common, they have the defect in the vitamin D receptors. This is called as vitamin D resistant rickets. So how much amount of vitamin D may be there in the body, it won't be able to activate the receptor. So this is very less common and very lethal. So here, if you want to treat, you need to directly give calcium and phosphate to the patient because the amount of vitamin D you give, it is not going to affect this one. So this is all about the common questions and queries for the vitamin D deficiency. If you want to know further or if you still have some queries or you need to have some clarification about the topics, please message me personally. Thank you.